Hey there, ho there, hey there, ho there, hey there, ho there. Okay. Starting our next lecture, we are going to look at the basics of nutrition. Right? This is going to look at nutritional basics, right? We're going to cover pretty much an outline or a guideline of what's going on here. So we've had a tutorial video, a couple of tutorials about macronutrients, micronutrients, and other nutritional components. This is going to go through the basis of nutrition. So purpose here is to provide nutritional information, including food sources and roles the nutrients play in the body. Going to be looking at things that are going to be equated to good nutrition, essential nutrients, roles of nutrients, measuring nutritional status, strategies to combat undernutrition, and national nutritional guidelines. So what do we do for good nutrition? All right. Good nutrition is going to be classified under the guise or the concept of incorporating healthily functional foods. All right. That means foods that are going to be constructive to your body, ones that provide with a lot of micronutrients and a lot of micronutrient profiles, vitamins and minerals, things like that, right? So we are going to consume foods and nutrients. Food and nutrient does not always mean the same thing. A food is going to be what we're actually ingesting into the body, right? Whatever physical food substance we're eating. Nutrients are going to be what is inside of that food, right? Forever lack thereof or abundance of. So food is the products that we're eaten or taken into the body. We need nutrients for all of these processes: development, growth, maintenance of tissues and cells, producing energy, warmth, and movement, carrying out the chemical functions, etc., etc. Essential nutrients. We have three categories. Water is classified on its own, so we keep water as a separate nutrient profile. We have macronutrients, the three: carbs, fats, and proteins, and micronutrients classified as vitamins and minerals. So I'll start out with the discussion, brief overview. All right. Carbohydrates, these are going to be where we derive most of our energy for cellular processes from. So this is going to be heavily based on sugars like glucose. Right? This is accounting for up to 80% of the diet in developing countries. It's quickly absorbed, especially simple sugars. Sources are going to be starchy fruits, cereals, and root crops. Macronutrients, again, fats and oils here is our second category. These are also energy giving. These are not produced by the body, so we do need a low level of fats and oils taken in order to keep things up and keep processes like cell membranes and cholesterol formation adequate. It's going to be more slowly absorbed, but it's going to yield a higher calorie per gram ratio, so you get more energy from it if it's needed. Fats include solids, which are saturated fats known as butter, ghee, lard, margarine, and we have oils, which are going to be liquids, unsaturated fats, like plant oils, soybean oil, corn oils. Third category is going to be proteins. Proteins yield the structural framework of the body and the body's processes. So these are going to form the major structural components of our tissues. Sources are going to be from plants. We get things like beans, nuts, and chickpeas. Get a large portion of protein from animal products. So things like eggs, meat, dairy products, fish. Micronutrients, vitamins and minerals. Start out with vitamins. Vitamins are going to be organic compounds that are found mostly outside of the body. They do not have any caloric content, so there's no nutrient availability as far as energy is concerned. We have fat soluble and water soluble. Fat soluble are going to be those that can be stored because they are dissolvable in lipids, so they can be stored in adipose tissue. These are A, D, E, and K. Then we have vitamin B complex and C. Vitamin B and C are going to be water soluble. So those are able to dissolve in water. They're absorbed into the bloodstream immediately. They are not able to be stored, so we need to replenish them pretty regularly. Sources are going to be things like fruits, dark leafy vegetables. Minerals are going to be inorganic compounds. So the difference here is that vitamins are organic compounds. Minerals are inorganic compounds. And in many cases, they are metal or metalloid. So these are inorganic compounds not synthesized by the body. They are needed in small quantities, but they are going to be essential in some cases for things like calcium, magnesium, things like that. So we are very important for biochemical processes. Sources include plants and animal products. Water is our final classification. Water is arguably the most important because we cannot go very long without it. So it's the main component of the body, makes up 60% of the bodily mass. We need it for almost everything that happens inside of the body. Digestion, absorption, all other body processes, we are going to need water. Regularly lose it through breathing, water evaporation, sweating, evaporation from the skin, excretion through the feces and the urine. Minimal is going to be about 1,000 milliliters or 1 liter per day. All right, so essential food products. If we're looking at essential food products, we have to find out what are going to be rich in these things. We need proteins, carbs, fats, vitamins, and minerals. So what are we going to get that's going to be able to give us these foods or to give us these nutrients? And we have to find foods that are rich in these substances in order to maintain an appropriate diet. Looking at energy requirements, the basic energy requirement is going to be how much is needed to maintain health, growth, and appropriate physical activity. This is going to be pretty wide ranging and subjective based on your age, gender, activity level. We're going to base it on basal metabolism, so how much energy your body actually needs to perform its basic functions. Metabolic response to food, how it is digested, absorbed, and utilized. That takes energy in itself. Physical activity, exercise, how much rest we're getting, what kind of activity we're doing on a physical daily basis, and our physiology, if there's any changes that are occurring. Things like pregnancy and lactation, those are going to increase our metabolic needs or energy needs, as well as things like adolescence and growth and young adulthood. So energy requirements for adults greater than 19 years of age. Again, this is going to be somewhat subjective. Our basal metabolic rate, or BMR, is the number of calories that are needed each day. To do this, we do a basic calculation of a BMR times an activity factor, which depending on how active you are will depend how great that activity factor is. Something like a mild activity is going to be a 1.5, and medium activity can be 1.7, heavy activity can be 1.9 or even 2, meaning that if we are performing heavy physical labor, we could potentially need up to twice as many calories over someone who is sedentary. Also need additional energy for those who are pregnant and lactating, right? We need energy for the fetus as well as for the suckling infant. Looking a little bit younger, children and adolescents, basically those who are under 18 years of age. This is going to be calculated based on age, physical activity, and growth, right? It's going to be an increase after the age of 10 to support bodily growth during puberty and adolescence. Kilocalories required per day. For boys, it's going to be anywhere from almost 1,000 to maybe close to 3,500, going from 1 to 18 years of age. For girls, it's going to be a little bit less, right? About 850 up to 2,500 between ages 1 and 18. An infant is going to be even lower than that, right? We mainly need energy here for growth, and it's going to be largely based on the age. So from 0 to 12 months, there is almost a month-to-month change as far as energy requirements. All the energy and nutrients are going to be met by breast milk for the first 6 months of life. So we're getting 500, 600, 700 calories from the breast milk at this time. Protein requirements. These are going to vary by age, health status, and amount of activity or exercise. So we're changing this pretty variably. Protein requirements are going to be much higher for physically active people, those who participate in weightlifting, resistance exercise. Also for those who are pregnant and lactating. It's going to fluctuate in children based on the weight, age, and gender. Undernutrition is going to be pretty common, right? We see the manifestation of inadequate nutrition in a lot of different contexts. If we're looking at this in areas such as third world countries that are underdeveloped, like sub-Saharan Africa, We see that a third of all children under 5 years of age are going to be underweight for their averages at that particular age group. And it's not just weight that is hindered here. We also see a height differential as well. So 38% of children are going to be a lower height than average for their age as well. Many causes, all right, lowered access to foods and nutrients here, improper care and parenting, limited health services to combat disease and ailments, and an unhealthy environment overall. Some common conditions that we see with over and undernutrition, right? Vitamin deficiencies. For deficiency of vitamin C, we get something like scurvy. For vitamin D deficiency, it can cause something like rickets in children, abnormal bone growth. Deficiency of B vitamins can lead to things like mental retardation and adrenal disorders as far as children are concerned. For mineral deficiencies, if we have calcium deficiency, that's going to be the most detrimental. It's going to cause osteoporosis or thinning of bone. Non-communicable diseases that are diet-related, things like diabetes mellitus, coronary heart disease, obesity, and hypertension or high blood pressure. So here, if we look at the causes of undernutrition, if I can zoom this in a little bit, hopefully I can. All right. So looking at the causes here, you have things like inadequate care for children and women, malnutrition, disease, inadequate dietary intake, inadequate access to food. All these things are going to lead to malnutrition, right? So basic causes are at the bottom here. Potential, right? Resources and control, human, economic, and organizational resources. If we have limitations here, this is going to be a big constituent for further down the line. So underlying causes that are going to be related to resources and control are the access to food, the insufficient health services, and inadequate care. Inadequate care and insufficient health services can lead to disease. Inadequate care and inadequate food can lead to inadequate dietary intake. Inadequate dietary intake can lead to disease. Disease can lead to inadequate dietary intake, so forth, so on. And that will manifest in malnutrition. All right. So nutritional status is going to be determined largely from anthropometry. It's going to be what our anthropometric measurements are. So this is things like circumferences of the arms and the legs, waist circumference, body fat mass. These are all anthropometric measurements. So for underweight, this is going to be a low weight for age compared to a reference standard. Stunting is going to be a low height for age compared to a reference standard and is an indicator of past growth failure. And wasting is going to be a low weight for height, right? That's an indicator of short-term nutritional stress. Other measurements of note, we have the MUAC, which is mid-upper arm circumference, body mass index, which is taking height and weight, putting them together for a score, compares height and weight. Manifestations of protein energy malnutrition. Number one is marasmus. Marasmus is indicated by severe growth failure. This means that we're going to have a weight that is less than 60% of the average weight for your age. You're going to have symptomology like extreme hunger, wrinkled skin, drawn-in face, thinness, and frailty. We have kwashiorkor, that's severe protein malnutrition. Weight is going to be a little bit higher, possibly 60 to 80% of weight for age. But we will see things like appetite loss, lethargy, swelling, and edema underneath the skin. If we put this together, marasmus and kwashiorkor, this is known as marasmic kwashiorkor. This is the most severe thing that we can have, all right? Combines conditions for both, so we see symptomology from both of these put together, and the weight is going to be less than 60% of the average for your age. So strategies that are going to be looking at this, strategies to prevent and control undernutrition. All right, we're going to improve household food security, improve diversity of the diet, improve the care, improve child feeding practices, ensure that child health care is there, and also provide nutritional rehabilitation. One thing that we see that's very common in malnutrition is going to be nutritional anemia. This is the most common type of anemia. In third world countries, this is caused by a lot of things like disease-causing agents like malaria, hookworm, and dietary deficiencies like inadequate iron and vitamin intake. These are all going to eventually lead to low hemoglobin levels or low red blood cell concentration. This is going to affect mainly pregnant women and children under 5 years of age because of nutritional deficiency, and we can detect this by measuring the blood hemoglobin levels as they are circulating. Effects of anemia, some of the obvious ones are going to be reduced capacity to carry oxygen. So we have reduced work capacity, reduced mental capacity, reduced immune competence, poor pregnancy outcomes, and risk of maternal death. In infants and children, it'll be even more severe. We can have growth development deficiencies. We can have disorders of mental cognitive development, immune competence, and reduced ability to grow and differentiate. Some strategies here to prevent and control anemia. All right, we promote iron, folic acid, and B12 rich foods. We can treat and prevent anemia-related diseases from things like malaria and hookworms. Provide iron and folic acid supplements, especially for those who are pregnant and lactating. Fortify foods with things like iodine. Promote vitamin C rich food meals, fruits, right? Grains, cereals, things like that. And discourage drinking coffee or tea with meals. One of our fortified food ingredients that we see on a regular basis is iodine. Iodine is extremely necessary for things like thyroid hormone production. And we see a nutritional deficiency and inadequate intake of iodine in developing countries because a lot of their foods aren't fortified. Most of the time when we have salt, it's going to be iodized salt or iodine fortified salt. So we never really have to worry about where our iodine is coming from. We only need really about one teaspoon or 1 teaspoon of this over an entire lifetime. Right? So iodine in food sources is going to vary by geography. It's going to be less in highland and mountain regions. Right? It's also leached from the soil and carried to lowlands. Some manifestations of iodine deficiency. Again, we have this largely in thyroid relation, so developing thyroid hormone. Manifestations are going to be in things like this. All right, we have a goiter, which is an enlarged neck over the thyroid gland. It's basically a growth or an outpouring of the thyroid gland looking like almost a tumor. We have hypothyroidism, which is going to be under activity of the thyroid or low metabolic activity. Dry skin, weight gain, puffy face, lethargy from an underactive thyroid. Hyperthyroidism is going to be the opposite. Right? We can have excessive weight loss, tissue wasting, rapid pulse, and things like that from an overactive thyroid. Finally, cretinism. Cretinism is going to impact children to a larger degree. This is where we have too little thyroid production in the developing person. So you see mental retardation, physical development problems, and spasticity, especially if we have a mother in pregnancy. All right, so strategies to control it. Again, we have the food that has been fortified with iodine. You see iodized salt all over the place. All right, dairy products and bread. Provide iodine drops as well. There are cases where we have water that is procured from rivers and wells, and we can put iodine drops in them. We can also inject people with iodized oils, but that is not the most effective way, especially in developing nations where we don't have adequate health care, right, in a lot of different places. And this is also an expensive mechanism. Next, looking at some vitamin deficiencies, right? So looking at vitamin A deficiency can lead to things like disruption of eyesight, poor eyesight, malformation of the skin, disruption of things like breastfeeding. So this is going to come from low consumption of vitamin A rich foods. Vitamin A rich foods containing things like carrots, squashes, yellow fruits and vegetables. Dietary deficiency due to food processing. Also, we can see it in infants if we have poor breastfeeding, no colostrum, and diseases that affect absorption, like chronic diarrhea and tapeworms, hookworms, things like that. So what is it going to do as far as manifestation? Well, we have the eye problems, as mentioned earlier. We have xerophthalmia. All right, xerophthalmia is going to be basically blindness that comes into the fray because of vitamin A deficiency. And vitamin A deficiency is the leading cause of blindness for children under 5 years of age. You can also have Bitot spots, which are going to be holes in your vision, pretty much areas where you have blackness in your visual field and damage to the cornea. For overall systemic growth, we can see slowed growth and development overall in the body, reduced reproductive efficiency and fitness, and an increased risk of blood anemia. Strategies to control it: promote vitamin A rich foods, things like fruits and vegetables, give infants and women low dose iron supplements, improve food security, feed children, prevent disease, and fortify foods with vitamin A. All right, looking at national guidelines. Okay, so we have national nutritional guidelines and strategies for things like general nutrition based on age group and demographic, infant feeding, how to treat children and growing fetuses, things nutrition and disease, something like nutrition and HIV infection, and also food security. So let's look at a couple of case studies here. So for case study number 1, it says food has been in short supply in your area. Mother brings her 3-year-old daughter. Is worried because the child has poor appetite, skin conditions, and excessive diarrhea. You notice swelling around the ankles, so there's edema there. What might she suffer from? So this is telling me that she might have kwashiorkor. I see the edema there. I see the excessive diarrhea. What is the appropriate course of action? Case study 2, 28-year-old pregnant woman attending an antenatal clinic, complains of shortness of breath, dizziness, fast heart rate. She asked about the food she has been eating. She says she's had little access to meat and fish since her pregnancy. So she is probably missing iron and missing calcium as well. So she's suffering deficiency from things like iron, maybe folic acid. Action, what I would recommend, supplementation for those, and possibly reintroducing animal sources into our diet if possible. Case study 3, let's see. Looking at community health workers. Notice that most children seem small or thin. Decided to assess the weight and height. First household, 24-month-old boy is going to weigh 13 kilograms, which is around 29, 30 pounds-ish, and is 80 centimeters tall. Again, this is about 30, 32, 33 inches or so. For a 2-year-old boy, that's a little bit small. So using growth charts in the appendix, assess this child. So our conclusions here for this lecture, okay? Good nutrition is essential for health and well-being. Daily well-balanced diets should include foods containing essential nutrients. Inadequate nutrition can lead to things like protein, malnutrition, vitamin and mineral deficiencies like blood anemia, vitamin A deficiency, and iodine deficiency disorders. Nutritional interventions are going to improve household food security, fortify foods with things like iodine, iron, and vitamins. Use vitamin and mineral supplementation, especially for people like women, children, pregnant women, lactating women, and small children, and improve child feeding. All right. That was our basics of nutrition lecture. Please like and subscribe to the channel. Subscribe to Twisted Science as well as our Patreon. We have patreon.com/twistedscience for additional content there. Thank you all for watching. I will see you at our next video. Peace out.